All right, let's talk about asthma. It's a condition that affects millions of people, but it's actually pretty misunderstood. So in this explainer, we're going to break it all down, what it is, what's behind it, and how it's actually managed.
Okay, so where do we even start? Let's go right back to the word itself. Asthma actually comes from a Greek word that means panting. And honestly, that's such a perfect description, isn't it? It perfectly captures that feeling of struggling for breath. But it's not just a momentary thing. It's a chronic, long-term inflammation of the airways.
So here's the bottom line. For someone with asthma, the airways inside their lungs get inflamed. They get swollen and they become way more sensitive than they should be. And when they narrow like that, it just becomes physically harder to move air in and out. That's the fundamental problem.
But the big question is, what's causing all this inflammation to begin with? So let's play detective for a minute and investigate the causes and the common triggers that can actually kick off an asthma attack.
Now, this is where it gets really interesting. It seems like the timing of when you're diagnosed can point to different root causes. Asthma that starts in childhood, so before age 12, appears to have a much stronger genetic link. It runs in the family. But asthma that pops up later in life, that's more likely to be triggered by environmental factors. And speaking of those environmental factors, here are some of the usual suspects. You can think of these as the sparks that light the fire in a sensitive airway. We're talking about everything from air pollution like smoke and exhaust, to everyday allergens like dust and pet dander, and even some common medications.
So you have the trigger. Now let's get to the main event. How does a simple trigger cause the body's own immune system to have a complete, total overreaction? This is where things get really wild inside the lungs.
It's basically a four-step chain reaction. First, the intruder, an allergen, let's say, is spotted by your immune system's lookout cells. They sound the alarm, activating a specific kind of cell called a T helper 2 cell. That cell then starts barking orders by releasing chemical messengers, which tell other cells to launch the attack. And that attack is what we feel, inflammation and tightened airways.
And if we zoom in a little closer, those chemical messengers have very specific jobs. It's like a two-pronged attack. One of them, IL-4, is responsible for that immediate reaction. It tells your mast cells to release histamine. At the very same time, the other one, IL-5, is busy recruiting an army of other inflammatory cells to the area, which sets the stage for a much longer-lasting response.
And this timeline really shows how it's not just over in a flash. An attack unfolds in distinct phases. Within minutes, you get muscle spasms in the airways. But hours later, that army of immune cells shows up and can actually start to damage the lung lining. And the really scary part? Over years of these attacks, this can lead to permanent, irreversible scarring that changes the lungs for good.
So, we've seen the whole internal battle play out. But what does all that microscopic warfare actually feel like for the person going through it? And what kind of damage does it leave behind?
Well, these are the classic telltale signs that the airways are in major distress. You've got the coughing, that awful tightness in your chest, the general feeling that you just can't get enough air, and of course, that very distinct high-pitched whistle when you breathe. That's called wheezing, and it's a dead giveaway that the lungs are obstructed.
Now, this is a really critical point. During an attack, the body goes into overdrive making mucus, which can form these thick plugs. And this is a total catch-22. Not only do the plugs block the airway, making it even harder to breathe, but they can physically block inhaled rescue medications from even reaching the inflamed tissue where they need to go.
Okay, so we have a pretty good handle on the problem now. What about the solutions? How do you actually call a truce in this internal war and get things back under control?
It might sound almost too simple, but the very first and honestly most effective line of defense is just staying away from the things that cause the problem. If you can minimize contact with your known triggers, you can stop that whole immune system meltdown from ever even starting.
To figure out the right battle plan, doctors classify asthma based on how often symptoms are showing up. It's a spectrum, right? It ranges from intermittent, where symptoms are pretty rare, all the way up to severe persistent, where it's a constant daily struggle. This classification is key to tailoring the right treatment.
And that treatment usually falls into two main categories. You've got your rescue medications. Think of these as the firefighters. They're fast-acting, they relax your airway muscles, and you use them for immediate relief during an attack. Then you have your controller medications. These are more like fireproofing the building. You use them every day to reduce that underlying inflammation and prevent the fire from starting in the first place.
But, of course, when things get really bad, like life-threateningly bad, you have to bring out the big guns.
In a hospital, that means escalating treatment to things like IV medications and direct oxygen therapy just to support the person's breathing.
So after all of that, all the management strategies, all the different medications, we come to this stark, really important number: 0. Right now, that's how many cures for asthma exist. We've gotten so much better at managing it, but a complete cure, well, it's still out of reach. And that brings us to our final pretty fascinating question to think about. There's this idea called the hygiene hypothesis, and it suggests that maybe, just maybe, because our modern world is so clean, our immune systems don't get exposed to enough germs when we're young, which might make them more prone to overreacting later. It really makes you wonder, right? In our effort to keep ourselves safe from everything, are we accidentally making our own bodies more dangerous? Something to chew on. Thanks for tuning in.